It's Friday, the 5th of December, and this is the Hot Topics podcast. Welcome to the Hot Topics podcast from NB Medical. Neal Tucker here as usual. And it's almost Christmas, everyone. But I'm not going to go on too much about Christmas because this is not the last podcast before the festive break. We are going to have a special edition in a couple of weeks with a special interview from one of my colleagues, Andy Ward, who is a specialist in empathy. Yes, even more so than most of us. So do keep an eye out for that. In the meantime, we've got 3 papers to cover today. One on social media, one on cervical screening, and one on insomnia. But as always, first, the news. I think we do need to mention about the National Screening Committee's decision on prostate cancer screening, given the fact we were talking about this in the last podcast, and particularly in context of black men, higher risk groups. So since then, the National Screening Committee has published their draft guidance recommending targeted screening for men with BRCA1 and 2 variants, so every 2 years from the age of 45 to 61, but they did not recommend population screening or targeted screening of other high-risk groups such as black males or men with a family history. Why not? Well, they felt that even using the modern techniques such as MRI as the initial step after a positive PSA test overdiagnosis of low cancers was still a problem, even in these higher risk groups. Plus, they cited some uncertainties in the data around these groups, which impacted the decision. They also mentioned that currently there is a huge trial being conducted in the UK called Transform. So this is funded by the government and Prostate Cancer UK, which is exploring prostate cancer screening, including looking at genetic markers for risk, with the hope to find a better initial test than PSA, which seems to be the rate-limiting step here. The National Screening Committee has recommended collaboration with that trial. This recommendation from them is only in a draft format at the moment. I'm sure there's going to be some lobbying, and even Wes Streeting has been weighing in to the discussion in the media. So you wonder if this may stop being a data-driven decision, become a political one at some point. The final guidance is due in March. Watch this space. I'm sure we'll talk about this more again. Elsewhere, what have we got in the news? The government doesn't like the BMA. The BMA probably doesn't like the government. Endless contract sagas. We're too close to Christmas to get into this all now. I'm just going to get myself a mulled wine instead. NB news, well, our courses are wrapped up for the festive season, but we'll be back with more live webinars in January. If you want to get updated before then, don't forget all of our courses can be viewed on demand. And if you sign up to MB Plus, then you get to come on all of the courses. You get to come on all the live webinars, do all the on-demand stuff, and loads more too. So do check out mbmedical.com for more information. Okay, shall we get on with the research? And our first paper of the day was published in this week's JAMA. It is examining the effect of social media use in children on their cognitive attainment. So literally, does social media rot your brain? Very topical at the moment, of course. Australia, in 5 days' time, if you were listening to this on the Friday, is about to become the first country to ban social media use for children under the age of 16. Not without its controversy, of course, particularly amongst all those 15-year-olds who are addicted to social media. Shall we do a little bit of scene setting here? So picture this, a government report quotes that children aged 5 to 15 are on average spending almost 5.5 hours per day on social media. 5.5 hours. They also said they sleep for 10, they're at school for 7. It barely leaves any time in the day for anything else. And of course, that's an average. So some kids will be spending less time, maybe none, and then others will be spending even more, presumably not getting enough sleep. What counts as social media? Facebook, Instagram, Snapchat, Twitter, or X, if you want to call it that. Also, of course, things like YouTube, TikTok, Reddit, LinkedIn, and then also purer messaging apps like WhatsApp. All of that counts as social media. I actually started getting a bit worried. Am I social media? Is this podcast social media? I'm pretty sure no 10-year-old has ever got excessively fixated on the Hot Topics podcast. No, Mum, I'm not going to go to bed. I've got to find out what Neal Tucker's going to tell us about hemorrhoids. The debate about the potential effect of social media on the population has been raging for years, particularly in respect to children and adolescents, of course. This concept is nothing new. When the radio was first introduced, there was apparently moral panic that it would destroy the society, corrupting the youth through exposure to filth such as rock and roll or jazz music. So is this all angst of oldies that just can't cope with change? Or was that very last comment just gaslighting from some global mega corporations owned by the richest men, always men, in the world that want to have global domination? Well, time to take a step back and try and be objective about this. Now, I'm talking about objective. I think last year I talked on the podcast about a book called The Anxious Generation by Jonathan Haidt. Have you read this yet? I'm sure many of you have seen this. It pulled together a broad range of research to ask why the youth of today have such high levels of mental health issues. And to cut a long story, or rather the whole book short, he concluded that a combination of social media exposure and, for want of a better phrase, I think helicopter parenting, perhaps one might say a lack of autonomy whilst growing up for the child, combined to drive a lot of this problem. The data in the book is purely observational and probably oversteps in the conclusions about how much we can infer causality about these issues, but it is a pretty compelling read. Go take a look at it. This new paper now in JAMA is not looking at anxiety, but it's looking at social media use and cognitive performance. Do children do worse in school and therefore, of course, potentially in the rest of their lives with greater use of social media at an early age? Now, of course, this is a podcast about health, about medical research, and I almost wondered whether this falls outside of that category, but I think it's probably reasonable to say if you do have lower cognitive attainment, then that's linked with poorer health outcomes in the future. And this is published in one of the world's leading medical journals, so I think it's probably fair game. Now, there are always going to be compromises when you're trying to answer this type of question. You can't do a randomized trial on it. But what the authors did was they used data from the ABCD study, which is the largest long-term study of brain development and child health in the US. So it includes almost 12,000 children from the age of 9 to 13 who are being followed up over a 7-year period. That's, I think, from the age of 9. And as part of this, they collect a wide range of data each year, including information such as physical and mental health, life achievements, academic process, also things like screen time, social media use, and the like. So this JAMA study looks at 6,500 of these children recruited in 2016, particularly focusing on social media time, so not just screen time, but specifically social media, and how that changed over the next 2 years or so. And then they compared this against cognitive performance measures, adjusting for variance in a wide range of baseline variables such as sex, ethnicity, mental health issues, and so forth. The children were split into 3 groups, determined by the amount of social media use. Everyone, all of these children, started off with relatively low use, so half an hour at most per day, many much less than that. Then the first group was those who would continue to have very little use, so less than 20 minutes per day of social media exposure. That was around 58% of these children. Second group was the low increasing use, where use increased throughout the follow-up period, and it went up to about an average of 1.3 hours per day. And then there was the third group called the high increasing group, which on average had the highest initial use, which then skyrocketed to between 3 or 4 hours a day. The kids underwent a series of cognitive tests, many of which I've never heard before, Flanker test, anyone? No, it's not your ability on a rugby pitch. It's a cognitive psychological experiment that measures selective attention and response inhibition. Yeah, I googled it. I am still none the wiser. They also tested reading skills, memory, processing speed, vocabulary. All of these were measured. So the results showed the higher the use of social media, the poorer the outcomes. That is a nice, easy statement. To give you some context, we can compare the total composite scores of those cognitive tests. So in the non or very low user group, the total composite score came out as 103.6. Now, the decimal point matters here because in that 1 and a bit hours of social media per day group, the total composite score was 102.8. In the high user group, it was 101.8. These are small but statistically significant differences. I have to say, I was almost a bit disappointed when I saw this. Clearly, I'm not that objective on this subject. I'll be honest, I was a little bit disappointed with these results because the differences do not seem that big. Now, it isn't a perfect study, but I don't think its limitations invalidate the results. I think that the limitations are more down to the design necessity of these studies than anything else. Due to the way it's measured, it isn't clear if exposure at one age has more impact than exposure at a different age. Also, it can't address directionality. So is it the social media driving the poorer cognitive scores? Or are children with naturally lower cognitive ability more drawn to social media? Possibly the most important issue for me is in this fast-moving world of technology and the internet. Are these results already old news? Think about how things have changed in terms of access to smartphones, the internet in general, since 2016. Smartphones are now ubiquitous. They're incredibly affordable. Loads of kids have them. Loads more kids have them than 10 years ago. Even kids under the age of 10 are often being given smartphones. And what we're looking at in this paper is only data up to the age of 13. Think what 15 or 16-year-olds are up to now. No doubt they're able to navigate the internet and social media with much greater skill than a dinosaur like me. And think how much more time they may be spending on their phones. This trial will continue to collect data, and in a few years' time it will be able to tell us about what's going on with 15 and 16-year-olds from a few years ago. Ingrained into the process is the fact that it's always going to be a bit behind. So what about the now? Well, the linked editorial feels the data remains valid and is important. Those differences may look small when I'm reading them out, but the reality is, on a population level, it feels that this does represent a significant issue. Is this data the final word on the subject? Definitely not. But could it be considered sufficient to influence policy on social media and children? Yes, it thinks so. And ultimately, the editorial concludes that, to quote, children, families and societies cannot afford to wait for perfect evidence that will never come, and policymakers cannot afford to wait any longer to act to safeguard our children. And to paraphrase these papers, what is clear is that maximising the benefits of social media and minimising the harms are not the driving motivation of profit-driven social media companies that dominate the marketplace. These are the richest companies in the world. They have a drive to extend their grip even further. They have a direct line to the most powerful government in the world. And if you want to see a bit more about that, I can't remember if I mentioned this last time, but I watched this Panorama documentary called Trump and the Tech Titans, which was absolutely terrifying. I'll put the link in the description below if you want to check it out. But I'm sure that having our kids' best interests at heart is not forefront in their mind. I also suspect that most governments around the world will look for more data before they institute the same kind of changes that Australia are about to embark upon. And of course, Australia is about to become the centre of a worldwide case study answering exactly the question that everyone else wants to know. But those answers are going to be years away. Let's hope it's not too late for this generation of children by the time we get those answers. Okay, on to our second paper, and this is in the BJGP. Urine human papilloma virus testing for cervical screening in a UK general screening population, a diagnostic test accuracy study. Flicking through this month's BJGP, there's always loads of interesting things to savour, but I wasn't sure any of the research quite fit for the podcast. And then I saw this. I looked at it and I thought, hasn't this been done before? Don't we already know the answer here? And then I thought, hang on, no practice is simply asking women to pee in a pot to check for cervical cancer. Surely that would be a much more welcome proposition than having a speculum and your cervix scraped. And if that was an option, we'd all be doing it. Especially as many of us, like me, are not allowed to do smears anymore. I used to be able to do them. They're not that hard, but now you need to have a number, and I don't have a number. I don't have the numbers to get a number, and the slow demise of general practice continues. Anyway, back on topic. I was doing a bit of Googling about this area, and this very subject had a paper published about it in 2019. It's even on the BBC News. Urine samples may replace the cervical smear. Lo and behold, it was actually the same research group that published that paper. It was up in Manchester. It was a smaller study of about 100 women showing both methods could be equally effective. But they very reasonably pointed out that a larger study would be needed to confirm the findings before this could be widely implemented. And this is the larger study. So 1,517 participants were recruited from primary and secondary care clinics in the UK. Aged between 24 and 70, they were attending routine cervical screening. And in a beautifully simple study, the women were asked to provide a first-pass urine sample prior to having a standard smear test, and then they compared the outcomes looking for the usual high-risk HPV. The urine test was collected in a special device rather than just peeing in a standard pot and sending it off. The device is important because previous data has demonstrated this device to be much more accurate than previously used urine collection methods. What did the results show? Well, the urine sample was highly accurate when compared against a standard smear. That's the easy answer because it goes quite technical, firstly with statistical analysis, looking at the relative specificity of the tests and concordance between HPV genotypes and much more. But I think the key points are this. So out of 1,517 women sampled, 25 were found to have CIN grade 2 plus after colposcopy, triggered by a positive smear for high-risk HPV types. So that's the type of changes that are potentially concerning and need some kind of intervention. It's only 1.6% of the study population. The urine sample identified 24 out of those 25, so 96% of them. The result is non-inferior to that of cervical sampling. Now, I don't know if that 4% that hasn't been picked up is important, but it is just one sample which was different. So it might be that we can't even be sure there's any real difference at all. The authors conclude that HPV tested urine collected with a first void urine collection device may have non-inferior diagnostic test accuracy to healthcare collected cervical samples in the UK general cervical screening population. Now, there is a second part to the study, which is possibly more interesting. Here, they explored women's acceptability of testing for cervical cancer using a wee sample on a simple questionnaire, which to me, the answer would seem pretty obvious. Surely that's preferable to having a smear. Surprisingly, 42% of people said they would prefer the current cervical screening process. 30% had no preference and 28% would prefer a urine collection. I mean, I was blown away by this. I'm so surprised that so many people are wedded to this traditional method, which is much more invasive and much more time consuming. Now, the paper doesn't explore further the thought process behind these results. That will make an interesting piece of qualitative research at some point, no doubt. Personally, I suspect that perhaps it's driven by a concern that either the urine sample is less accurate, perhaps because we have this cognitive bias that procedures that are more unpleasant are more likely to be better. Or maybe it's that they're concerned that they'll do the test wrong, making it unreliable, and having a trained healthcare professional doing it is more reassuring. Anyway, we're a little way off the screening program changing, but with rates of participation in screening dropping, this might be a way to improve this, especially maybe targeting those patients who are being put off by the current method. On to our final study now. This was published in the BMJ this week, and this is for all of you people out there who, like me, sometimes have some difficulty sleeping. This is Tai Chi versus cognitive behavioral therapy for insomnia, for treating insomnia in middle age, that's me, and older adults, not me yet. So we know that CBTi is very effective for lots of people. We know that access isn't always great, and despite online methods also proving effective, not everyone gets along with this or benefits from psychological treatments in the first place. Could Tai Chi be an alternative? In the introduction, the paper sells up on it. Global popularity, suitable for older adults even if they are unfit or inactive, inexpensive, easily accessible, could be implemented on a large scale in the community. Do you fancy doing some Tai Chi at your practice? I wouldn't mind a go. And existing data suggests it could be useful for insomnia management, but that data has usually been compared to other exercise modalities. What about when it's compared against the big dog, CBT for insomnia? So this study was conducted in Hong Kong, where apparently 30 to 50% of middle-aged and older adults have insomnia issues. I have absolutely no idea how that compares to rates in the UK, but I've been to Hong Kong and it is pretty mental in some parts of it. So perhaps it's not surprised that people are having a difficult time sleeping. You can buy melatonin out there in Hong Kong. I got some in just like a random shop, tried it out for jet lag, made me feel absolutely terrible. So I probably could have done with some Tai Chi instead. Anyway, back onto topic. The researchers recruited 200 participants over the age of 50 with chronic insomnia and randomized them to either CBTi or Tai Chi for 3 months of an intervention and then followed them up for a further 12 months. In case you're wondering about the interventions, for Tai Chi, people attended a 3-month instructor-led training program with between 6 and 12 people in each group, and they adopted the 24-form Yang style, which means absolutely nothing to me, but is apparently the one that's most commonly used in research. They had a 1-hour session twice a week for 12 weeks. CBTi was also instructor-led, same group sizes, same number and timing of sessions, but was just CBTi. Improvements or otherwise were then quantified using the Insomnia Severity Index score, the change in which was the primary outcome. So the results then, at 3 months, CBTi was much more effective. It had a 11-point reduction in the 28-point Insomnia Severity Index compared with just 6 in the Tai Chi group. A change of 8 is considered the minimally important difference clinically. So at 3 months, Tai Chi didn't even meet that. It's a different story by 15 months. Both groups had a reduction in scores of 9.5, making Tai Chi non-inferior to CBTi over this longer period. What can we conclude from this? Maybe Tai Chi isn't for everyone and in the short term appears less effective than CBT for insomnia. In the longer term, both appear to be useful and we could be positive then about either for our patients. Having more options is always welcome. Final thoughts. I do wonder if there had been a third group in this study, a control group where patients had no intervention. I wonder what changes in their insomnia scores we would have seen by 15 months for them. I guess we'll never know, but please don't let it keep you awake at night. That's it for the research today. Thank you so much for joining us on the Hot Topics podcast. As usual, we'll be back in a couple of weeks or so with that special edition with my friend Andy Ward talking about empathy in general practice. Remember, you can always get in touch on email, hottopics@nbmedical.com. Find us on Facebook, Twitter and X if you're not worried about your social media usage. And until next time, I hope December treats you well. Take care. Bye-bye.